Hi sir, nice to meet you.
Hello, nice to meet you too.
Yes, let me introduce about you to the Myanmar patients. This is Dr. Amit Javed, who is the well-experienced surgical oncologist in the Fortis hospital. So can you start the conversation?
Of course.
Yes.
So first of all, I would like to thank you for having me here and introducing me to your patients in Burma.
Yes.
Friends, I am Dr. Professor Amit Javed, and basically I am a gastrointestinal surgeon. So a gastrointestinal surgeon is a surgeon who does surgeries of the entire gastrointestinal tract. So if you have any problems related to your esophagus or the food pipe, your stomach, your intestines, colon, rectum, liver, pancreas, so I am a specialist surgeon for that.
Okay, sir. So let me start with our old patient. One of the patients with the hiatus hernia and the colonic polyp, who is already operated by you. His outcome is very good, and the patient is so satisfied. So could you please explain about that case?
Okay. So friends, very recently we had a patient who came to us from Burma, and this gentleman was a sailor, and his problems were that he was having lot of acidity issues, lot of reflux symptoms, acid reflux symptoms for the last 10 to 15 years. Now this gentleman, because of severe acid reflux issues in the last 10 years, hadn't slept properly. He was sleeping on a chair. That is how the adjustments that he was trying to make because of these severe symptoms of hiatus hernia. So friends, what is a hiatus hernia? Hiatus hernia means that a part of the stomach from the tummy migrates into the chest. Now when this thing happens, there is a lot of reflux of acid from the abdomen into the chest. So the patients, they will start experiencing burning in the chest. They will have sour fluid coming back into their throat. Patients can have chronic headaches. They can have a lot of burping issues, ulcers in the mouth. And this gentleman was experiencing all these symptoms for the last 10 to 15 years. In addition, of late, he noticed that he had started bleeding from the rectum. Now, when he started bleeding from the rectum, he went to a local doctor, got a colonoscopy done, which showed a large polyp in his colon, in the part of his large intestines. And for the surgery of this large colonic polyp and the hiatus hernia, this gentleman had come to us, and we did a laparoscopic surgery for him. And by God's grace, he is happy, he is fine, and he is back to your country.
Sure, of course, yes. Okay, so as far as we know, at the Fortis hospital, there are surgery types is laparoscopic, robotic, open surgery. So could you please explain about the pros and cons and any advantages of each surgical type? Yes.
Okay. So friends, now surgery as a branch, as a science, has progressed over the last 50 to 75 years. Initially, all surgeries were done by open techniques, wherein the surgeon used to give big incisions, and it was a dictum. People used to say a big surgeon does big surgeries by big cuts. Okay, but time changed, and with changes in time, the open surgery gradually is now becoming obsolete. It is now becoming the thing of the past. The surgeries, even the most complicated surgeries nowadays, are done by the laparoscopic or keyhole surgery or by robotic surgery. Now, friends, I was in the Memorial Sloan Kettering Cancer Center in New York, and I was also a faculty and assistant professor in the Department of Abdominal Transplant Surgery, abdominal surgery at the University of California, San Francisco, USA. Now, during my stay there, we were doing a lot of advanced, even the most advanced cases, including transplantation by the minimally invasive approach. Now, the advantages of doing a minimally invasive laparoscopic surgery is that you give just small, tiny incisions on the abdomen. Now, when you give these small incisions on the abdomen, the pain is much less. The recovery of the patient is very fast. So the next day after surgery, you will find that despite the magnitude of the surgery, the patient is not having any pain. He is walking around in the ward. He is feeling hungry. So the recovery because of this laparoscopic technique is very, very fast. That is one biggest advantage. The second advantage is that when we do these laparoscopic surgeries, you will have a very advanced vision system, wherein the vision is of a 4K quality, a 3D vision, a magnified vision, where you're able to see things much, much clearer than you would see by an open surgery. So the dissection is more meticulous, the blood loss is very less, so the overall outcomes are very, very good and much better than an open surgery. Third, last but not the least, because you don't have big scars on your tummy, so the cosmesis, so if somebody has to look at the tummy, people will not even know that the patient has undergone a big surgery. So these are all advantages of laparoscopic surgery. So nowadays, I would say, if I talk about the spectrum of surgeries that we do, I would say 95% of our surgeries are laparoscopic and robotic. About 5% would be open surgeries.
Okay, sir. Thank you, sir. So in Myanmar, like GI tract tumor, GI tract cancer cases are increasing in number. So could you please explain about the role of the surgical oncology for that kind of a case?
Okay. So friends, I would say that of course in Myanmar cancers are increasing, but I would say that this is the trend across the world. So in all countries, because of the changes in our lifestyle, we are seeing an epidemic, a rise in the cases of GI cancers. Now, as I was mentioning, that we do surgeries for the entire abdomen, entire GI tract. So we would be treating all patients of GI cancers. And I think what we do differently from others, so there would be surgeons even in Burma who are doing cancer surgeries, but the difference that we do, if I compare even surgeons in India or surgeons abroad, they would be doing cancer surgeries by big open surgeries, right? We do all these surgeries by the minimally invasive laparoscopic approach. So surgeries of, say, esophageal cancer, that is food pipe cancer, surgeries for stomach cancers, surgeries for colon and rectal cancers, liver cancers, gallbladder cancers, even surgeries as complex as a Whipple's operation, which is done for pancreatic cancer. All these surgeries we would do by the laparoscopic or the robotic approach.
Okay, sir. Okay, sir. So another in Myanmar, another increasing case is the pancreatic diseases like chronic pancreatitis, pancreatic cyst, and then the pancreatic cancer. So is there any treatment options for those kinds of cases?
Okay. So friends, talking about pancreatitis, so as the name suggests, pancreatitis means that there is some inflammation of the pancreas. Now this inflammation can be an acute inflammation, wherein the patient has sudden onset severe pain which is present in the upper abdomen, goes back to the back. Patients at times can become very sick. They can get hospitalized because of severe pain, can have complications. We treat these patients here. There is another spectrum of patients, those patients who have chronic pancreatitis. So what is this chronic pancreatitis? Chronic pancreatitis means that there is a very long history. These patients have severe terrible pain in the abdomen. These patients have digestive issues. These patients can also have diabetes, because pancreas is an organ which is important for fat digestion. So these patients will complain of passing oily stools. Pancreas is very important for producing insulin. So these patients will have diabetes. And if we do some tests, especially if we do a CT scan or an MRI, what we will find in these patients are that there are big stones inside the pancreas, right? Now, there are a lot of ways to treat a patient of chronic pancreatitis, starting from medical treatment to endoscopic methods to surgery, right? I would say that the best treatment for a patient of chronic pancreatitis, a patient who has recurrent abdominal pain, patient who has stones in the pancreas, the best treatment for these patients is by surgery. Now, we are invited at different international conferences to demonstrate how to do laparoscopic surgeries for chronic pancreatitis. So surgeries for pancreas are challenging surgeries. Okay, they are not done by every surgeon. They are done by limited hepatopancreatic or biliary surgeons. Now we would do even the pancreas surgeries, the most difficult of them, by the laparoscopic approach. So very recently we had a lady who is 75 years old. She's an elderly lady. She had multiple stones in the pancreas. I did her surgery 2 days back by laparoscopic technique, and today when I go for the rounds in the ward, she is walking around and she says, has my surgery been done? Because she's like so comfortable after the surgery. So this goes for chronic pancreatitis. Now if we talk about pancreatic cancer, now friends, the strongest risk factor for pancreatic cancer is tobacco use. So either smoking or chewing tobacco is a very strong risk factor for pancreatic cancer. Now broadly, if we divide pancreatic cancers, I would say they are broadly of two types. One is pancreatic cancer present on the right side. One is pancreatic cancer which is present on the left side. Patients who have pancreatic cancer on the right side will usually present early because they develop jaundice. Okay, so they manifest early, the disease is picked up early, so the treatment can be initiated early. On the other hand, patients who have cancers on the left side, initially their symptoms are very vague. They can have mild abdominal pain, they can have vague discomfort in the tummy, they can also experience some amount of decreased appetite and weight loss. So usually these patients would miss, they would attribute these symptoms to certain digestive issues. So they would miss the early symptoms of pancreatic cancer, and most often the pancreatic cancers on the left side are picked up when the stage is slightly advanced. Now friends, if we have to do surgery for pancreatic cancer, even if it is a Whipple's operation, which is supposed to be one of the very big operations, cancer operations, we have one of the largest experience in India and probably one of the largest experience in the world of doing these surgeries by laparoscopic technique. So our patients, second day after surgery, after a laparoscopic Whipple's operation, they are walking around in the ward as if nothing has been done. I would also like to briefly mention about a patient that we treated in this hospital a couple of years back. Now this lady was from Afghanistan, okay, and this lady was 6 months pregnant with a big tummy, a big baby, when her pancreatic cancer was diagnosed, and she required a Whipple's operation. Okay, she had gone to different countries, okay, and sought opinion from various specialists, and she was very concerned because this pregnancy was a very precious pregnancy for her, and she wanted a guarantee that she should be fine and her baby should be fine. And we were able to give her that guarantee. We operated this lady here in this hospital, and she and her baby had a wonderful outcome. Okay, she had a very smooth recovery following her surgery, and then subsequently after 3 months she delivered a baby boy. Okay, and I think this was the first time in the world wherein a laparoscopic wherein a Whipple's operation was done for a lady with 6 months pregnancy.
Oh, yes.
Okay.
Yes, yes.